Okay, let's unpack this. We are diving deep today into some core techniques crucial for understanding how we work with tissue.
Mm-hmm.
This is absolutely essential stuff if you're getting ready for a practical exam.
Definitely.
Think of this as your ultimate shortcut, really, a distillation pulled directly from the material you shared with us, designed to give you the precise language and understanding you'll need.
That's right. Our mission is laser focused today. We're going to break down 5 foundational massage strokes: effleurage, petrissage, friction, oscillation, and tapotement, by looking only at how they're described in your source material, what their stated uses are according to that same source, and the specific techniques listed.
Exactly, just what's in the text.
Yes. We will stick rigorously to the definitions and details provided, extracting every important nugget about the what, the why, and the how for each stroke exactly as written.
Exactly. The goal here is to get so crystal clear on the fundamentals, straight from your text, that you can not only perform them confidently, but also, articulate their description, uses, and specific techniques precisely when you're demonstrating them for your exam.
Right. Being able to say it while you do it.
Yeah, we're essentially translating the key information from your source into a conversation that helps you internalize it.
So get ready to understand not just the names of these strokes, but their specific mechanics as described, their intended applications based on the source, and the exact how-to for their variations. This is all about mastering the language and the movements directly from your study material. Let's begin with what's often considered the foundational stroke, the one that starts the sequence, effleurage.
All right, kicking things off with effleurage. When your source describes this stroke, what is the core definition it provides? What is the fundamental nature of effleurage?
The description is quite precise and I think gives you the immediate feel of the stroke. Effleurage is described as a smooth, stroking, gliding, or gliding movement following body contours.
Smooth, gliding, following contours.
Okay. Yeah, this tells you right away about its quality. It's meant to flow effortlessly and adapt to the natural curves of the body you're working on.
And it says how it's applied.
Yes, your source explicitly states that it's applied with any part of one or both hands or the forearm.
Oh, okay. Or the forearm. That's good to know.
Yeah, it highlights its versatility. You're not limited to just fingertips or palms. You can use a larger surface area like the forearm for broad strokes, allowing for flexibility depending on the body part and desired effect.
Got it. And there's something about contact.
An absolutely key characteristic highlighted in the description is that continuous contact is maintained with the client's body.
Continuous contact. That sounds important.
It's incredibly important for effleurage. That unbroken connection is fundamental to the stroke's ability to soothe, to feel calming and fluid, and as we'll see later, it's also critical for assessment. You're not lifting your hands during the application of an effleurage stroke itself.
Okay. And the pressure, how's that described?
And finally, the pressure is described as being constant and evenly distributed across the contact area.
Constant and even.
Exactly. This contributes significantly to its smooth, flowing nature. The pressure isn't pinpoint or digging. It's broad, consistent, and spread out over the surface area you're using.
Right.
This helps explain some of its primary effects, like soothing and encouraging fluid movement. So in essence, effleurage, according to your source, is about continuous, even, smooth gliding that follows a body's shape, using various parts of the hand or forearm.
Okay, so smooth, gliding, following contours, continuous contact, even pressure. Got it. That paints a very clear picture of the basic feel and application method of effleurage, straight from the source. Now, why do we use effleurage? What are its specific purposes listed in the source material? What makes this stroke useful, according to the text?
The uses listed cover a wide range of essential functions, many of which are indeed foundational to a massage sequence and for that initial client interaction.
Like what?
First, and quite practically, it's used to apply lubrication.
Makes sense.
It makes perfect sense, doesn't it? Given the smooth gliding motion, it's the most natural and effective way to spread your oil, lotion, or cream evenly across the skin surface, preparing the tissue for further work.
Okay. And introducing touch.
Yes, your source also lists it as how you introduce the client to touch. Those long, smooth strokes with even pressure and continuous contact are generally non-threatening and help the client become comfortable with your hands on their body, building trust and establishing that therapeutic relationship right from the start.
So it's calming.
It explicitly helps you soothe the client, likely due to those long, smooth strokes combined with continuous, even pressure. This calming and relaxing effect is one of its primary therapeutic benefits and a key reason it's used early in a session.
And you mentioned assessment earlier.
Yes, importantly, it's listed for its use in helping you assess superficial tissues.
Ah,
Think about that continuous even contact we just discussed in the description. As you glide smoothly over the skin, maintaining that contact, you're able to feel the texture, temperature, resilience, and general state of the tissues just below the skin surface.
like the skin itself.
Yeah, the skin itself, the superficial fascia, and underlying muscles as you move across them. You're gathering initial information about the client's tissue.
Okay, what else? Circulation.
It's also used to increase circulation and promote lymphatic fluid movement.
How does it do that?
Well, the directional nature of effleurage, often applied towards the heart on the limbs or following the path of lymphatic drainage, aids these systems by encouraging the flow of venous blood and lymphatic fluid through the tissues.
Right, that gliding push.
Exactly. The pressure, though light, is enough to influence these superficial vessels.
Got it. And it's used at the start and end.
Crucially, your source states it's the stroke used to begin and end a massage sequence.
Ah, okay, bookends.
Yeah, it bookends the session, starting with introduction, lubrication, and initial assessment, and finishing with soothing, integration, and that final calming touch.
And for transitions, too.
And it serves as a bridge to transition from one stroke or body segment to another. It allows you to seamlessly move from, say, working on the back to transitioning to the neck or arm, or from a broad effleurage application to a deeper stroke like petrissage without abruptly lifting your hands and breaking contact.
Right, that continuous contact again.
That continuous contact from the description is vital here.
That's quite a list. It really underscores effleurage's role as the essential connective tissue of a massage, you could say. It sets the stage, provides soothing, helps you gather information about the superficial tissues, moves fluids, and acts as the beginning, end, and transitions. It truly is the workhorse stroke in terms of flow and integration.
Absolutely.
So, knowing why we use it and what it is, how do we actually perform effleurage? What are the specific techniques described in your source that fall under the umbrella of effleurage? This is key for demonstrating the stroke correctly in your practical exam.
Right, the specifics. The source outlines several distinct techniques under effleurage, each a variation on that smooth gliding principle, tailored for different areas or purposes. First, there are sweeps.
Sweeps. Okay, what are those?
These are described as broad or lengthy strokes, often ovals and figure eights.
Ah, okay, the big flowing ones.
Exactly. The detailed section provides more context on sweeps. They are generally performed at a slow, consistent speed.
Slow and consistent.
Yeah, reinforces the soothing, flowing nature we discussed in the description. They can be done with one or two hands, hand on hand.
Hand on hand, okay.
Using two hands side by side or one hand on top of the other allows for covering more surface area or applying slightly more pressure while maintaining that smooth, even quality.
Right.
You can use a figure eight or oval pattern in order to perform a continuous motion. This describes the common visual and kinesthetic patterns of sweeps, allowing you to cover large areas like the back or a limb smoothly without lifting your hands, maintaining continuous contact.
And where can you use them?
And the source notes they can be performed on most areas of the body, highlighting their versatility.
Okay. Sweeps. What's next?
Next, we have a directional variation called fanning.
Fanning, like fanning outwards.
Exactly. This involves overlapping strokes driving away from the practitioner.
Okay. Driving away.
The detailed explanation for fanning adds that it's literally pushing tissue away from you.
Right.
Visually, you're often spreading outwards or downwards away from your body's center. It's generally performed with the fingertips and palm, but can also include the forearm to give the stroke a longer feeling.
So you can vary the tool.
Yes, vary the tool and reach of the stroke. It can be done on most areas of the body, but shines on the back and abdomen.
Back and abdomen, okay.
Yeah, these are large, relatively flat areas where the fanning motion is particularly effective for covering ground or moving fluids outwards.
Makes sense. Is there a pulling version?
There is. Then there's the complementary stroke, pulling, described as overlapping strokes drawing toward the practitioner.
Okay, the opposite of fanning.
Exactly. The detailed section elaborates on pulling. It's the inverse motion, literally pulling tissue towards you. You're drawing your hands back towards your center.
Gotcha. Same tools.
Generally performed with fingertips and palms, but can include the forearm to give the stroke a longer feel. Again, allowing for variations in scale and feel.
Any precautions?
It notes to be cognizant working around breast tissue.
Oh, right. That's important.
Yes, a crucial practical consideration, reminding you to adapt the stroke and hand position to ensure sensitivity and appropriate technique in that area.
And where is pulling best used?
Like fanning, it can be done on most areas of the body but shines on the back and abdomen. The interplay of fanning and pulling allows you to cover and address large areas effectively.
Okay, sweeps, fanning, pulling. What else?
There's also V-draining.
V-graining. Sounds specific.
It is described as sweeping toward the heart on the limbs with web of hand.
Ah, with the web of the hand. Okay.
Yes, this technique is very specific in its application on the limbs, and the tool used the web or space between the thumb and index finger.
Why that shape?
Well, this hand shape often lends itself well to molding around the contours of a limb while sweeping upwards towards the torso, specifically aiding venous and lymphatic return, aligning with effleurage's use in promoting fluid movement.
Okay, V-draining for limbs. Is that it for effleurage techniques?
One more, a very distinct one listed under effleurage, is nerve stroke.
Nerve stroke. That sounds different.
It is. It's described as a very light drag of fingertips.
Very light.
The detailed explanation for nerve strokes clarifies it's a gentle, continuous dragging of the fingertips along a body part. The emphasis is on gentle, minimal pressure and continuous contact, aligning with effleurage's core description.
Okay. Which direction?
It's generally performed proximal to distal on the limbs, so moving away from the core of the body towards the extremities.
How often?
It's typically performed once or maybe twice and is used to close out a sequence or transition to a new area.
Ah, like a finishing touch.
Exactly. This positions it as a finishing touch, a very subtle bridge, or a way to calm the nervous system after deeper work. It's generally performed on the back and the limbs, areas with sufficient length for the dragging motion.
That level of detail is incredibly helpful, especially for the exam, knowing exactly what to do and, more importantly, how to articulate why you're doing it and what it is based on the source.
Precisely.
So to recap effleurage based on your source, it's smooth, gliding, continuous, uses even pressure applied with various parts of the hand forearm. Its uses, as listed, are foundational: applying lubricant, introducing touch, soothing, assessing superficial tissues, increasing circulation lymphatic movement, beginning-ending sequences, and transitioning.
That covers it.
And the specific techniques listed under this category, each with their own feel and application, include sweeps, broad, oval figure 8, fanning, pushing away, pulling, drawing towards, V-draining, sweeping limbs towards heart with a web of hand, and the very light nerve stroke, gentle drag, often proximal to distal.
Yes.
Understanding the connection between the description, like continuous contact, and the uses, like superficial tissue assessment, is really key for demonstrating competence.
Absolutely. Knowing those specific distinctions, like the direction of fanning versus pulling, the tool used for V-draining, or the precise definition and application of nerve stroke as a very light drag, is crucial for articulating and performing the technique correctly according to your source material. Effleurage truly is the essential starting point in connective stroke.
Okay, moving on from the smooth glide of effleurage, let's get into something that sounds like it involves more direct manipulation of the tissue itself. Petrissage. How does your source describe this technique? What is its fundamental action?
Well, petrissage is described fundamentally as a lifting, stretching, or squeezing movement.
Lifting, stretching,
Yeah.
squeezing. Okay, different feel.
Immediately tells you you're engaging the tissue in a profoundly different way than the gliding action of effleurage. You're actively manipulating the soft tissues.
And it mentioned drawing away.
Yes, a key element distinguishing it and a core part of its description is that soft tissues are drawn away from underlying structures.
Drawn away. Okay, that's a big difference.
It's crucial for understanding petrissage. You're often picking the tissue up or pulling it slightly away from the bone, the deeper muscle layers, or adjacent structures. You're not just compressing into the body, you're creating separation and space.
Applied with.
Similar to effleurage, your source notes it's applied with any part of one or both hands or the forearm.
Okay, still versatile there.
Yes, indicating flexibility in the tool used, allowing for different depths, surface areas, and grips depending on the technique and the body part.
And the pressure. Is it just squeeze and let go?
No, the pressure dynamics are mentioned as part of the description. Pressure is applied and released smoothly. While you're applying pressure to lift or squeeze the tissue, the transitions into and out of that pressure phase should be gradual and fluid, preventing discomfort or a jarring sensation for the client.
Right.
So, in summary, petrissage, according to your source, is about smoothly applied and released, lifting, stretching, or squeezing, specifically drawing soft tissues away from deeper structures, using hands or forearms.
So lifting, stretching, squeezing, drawing tissue away, that already paints a picture of working more directly with the bulk of the muscle or soft tissue mass, engaging it differently than a surface glide. How do these actions translate into therapeutic benefit? What are the specific uses of petrissage according to your source? Why would we choose this stroke?
Well, the uses listed directly reflect this deeper engagement with the tissue layers. It's used to assess superficial muscle and connective tissue layers.
Assess again, but deeper.
Yes, by lifting and squeezing the tissue, you can feel the quality of these layers with much more detail than with just effleurage. You can identify areas of tension, restrictions, changes in texture, or density within the muscle belly and the fascia surrounding it. That drawing away motion described helps you isolate and feel these layers.
Okay, circulation too.
It helps to increase circulatory movement in tissue spaces. The rhythmic compression, lifting, and release inherent in petrissage acts like a pump, helping to move blood and interstitial fluid through the tissues more effectively.
And stretching. The description mentions stretching.
Exactly. It's used to stretch muscle and connective tissue, which aligns directly with its description as a stretching movement. By lifting and elongating the tissues, you can help improve their flexibility and the client's range of motion, particularly after muscles have been shortened or tightened.
Good for tight muscles then. Spasms.
Yes, it can reduce muscle contraction or spasms. Working directly with the tissues that are tight or involuntarily contracting, the lifting, squeezing, and rhythmic manipulation can encourage them to relax and release held tension.
And what about stuck stuff? Adhesions.
It helps to loosen subcutaneous adhesions.
Subcutaneous. It's so near the surface.
Yes, drawing the tissue away from underlying structures and manipulating it helps break up those sticky spots or restrictions that form between the skin, the superficial fascia, and the muscle below. This is a direct application of the drawing away description.
Interesting. What about digestion? That sounds unusual.
It is interesting. Your source lists it as helping to increase movement in the stomach and intestines.
How would that work?
It suggests it can affect deeper visceral functions, likely through indirect pressure and movement applied rhythmically to the abdominal area, stimulating peristalsis. It's a fascinating example of how manipulating external tissues can influence internal processes, according to your source.
Wow. Okay. Any other uses listed?
And it's used to minimize wavy skin, addressing surface irregularities, presumably by improving the underlying tissue tone, reducing superficial fluid pooling, or breaking up adhesions that might cause the skin to appear uneven or wavy.
Huh. Yeah.
The action of lifting and manipulating the superficial layers, particularly with techniques like skin rolling, can directly influence the appearance and feel of the skin and fascia.
Wow, that's quite a range of uses, from assessing muscle quality and releasing restrictions to impacting digestion and skin texture. It really emphasizes how this stroke gets into the tissue.
It really does.
Now, what are the actual techniques listed under petrissage in your source? How do you perform these lifting and squeezing actions in practice? For the exam, knowing these is vital.
Right, the specific how-tos. The source lists several distinct techniques that embody the petrissage principle. First, there's kneading, described simply as tissue is rhythmically compressed in and between hands.
Kneading, like bread dough.
Sort of. The detailed explanation for kneading adds that this compression happens by the hands. It notes there are two variations within our portfolio for working on adhesions or knots.
Ooh, specific variations.
Yes, specifically named as scoop and shovel and bread kneading.
Ah, okay, so bread kneading is one type.
Exactly. Both are explicitly described as great for working on adhesions or knots. This tells you that kneading is a primary technique for addressing localized areas of tension or restriction.
Where can you knead?
This technique can be performed anywhere on the body where there is sufficient tissue mass to pick up and compress between your hands or fingers.
Okay, kneading. What's next?
Then there's wringing, where tissue is compressed and lifted between passing hands.
Wringing, like wringing out a cloth.
That's the idea. The detailed explanation for wringing adds that it's essentially a combination of fulling and fanning.
Fulling. We haven't covered that yet.
Right, we'll get to it. But essentially, it means you're performing complementary actions simultaneously, pushing tissue with one hand and pulling tissue with the other hand.
Ah, okay, like a twisting.
Yes. The tissue is lifted and compressed between the hands as they pass. This creates a sort of twisting or wringing effect on the tissue mass. It's performed slowly and with intention.
Slowly, okay.
This deliberate pace allows you to feel the tissue response and adjust your pressure. It is generally performed on broader surfaces such as the back, abdomen, and thighs, areas with enough tissue bulk to grasp and wring.
Got it. So fulling was mentioned? What's that?
Fulling is described as tissue is compressed, then lifted and spread.
Compressed, lifted, spread. Okay.
The detailed section for fulling specifies it involves compressing tissue down towards the table, giving the tissue a gentle squeeze, followed by a lifting of the same tissue.
So down, squeeze, lift.
Yes, it's a three-part sequence. It's generally this stroke is performed by both palms opposing each other, which allows you to gather and compress a larger amount of tissue effectively. However, it can be performed one-handed in certain areas of the body, offering adaptability.
And where is fulling used?
Fulling is generally performed on the back, abdomen, and limbs.
Okay. Kneading, wringing, fulling, more.
Muscle squeezing is a technique where tissue is compressed and held in or between hands.
Just squeezing and holding.
Well, the detailed explanation for muscle squeeze adds that tissue is compressed by the hands. But then, crucially, the tissue should slowly release from your hands as you hold.
Ah, so you wait for it to release. That's important for the practical exam.
Very important. It's not just about squeezing hard. It's about applying pressure and allowing the tissue time to respond and soften under your hands. As the tissue lets go, be careful not to pinch.
Good tip.
Yes, a crucial practical tip to avoid causing sharp discomfort. Also, encouraging the client to exhale during this will help with relaxation of the tissue.
Using the breath. Okay.
Connects the client's breath to the technique, using physiological relaxation to enhance the tissue's release. This can be performed on most areas of the body as long as sufficient tissue can be accessed, requiring enough muscle bulk to grasp and compress effectively.
Muscle squeezing. Got it. Anything else under petrissage?
Lastly, skin rolling is a distinct and important technique listed under petrissage, specifically manipulating the superficial layers. It's where skin is lifted and rolled between fingers and thumb.
Skin rolling. Sounds descriptive.
It is. The detailed section clarifies skin rolling. Skin and superficial fascia are compressed and lifted away from the underlying structures.
Okay, so definitely superficial.
Confirms it's working very superficially, focusing on the layers just below the skin and separating them from the muscle below. It is then rolled across the body using the thumb and fingers. This creates a visible wave of skin and superficial fascia moving under your fingers.
Does it need oil?
Actually, the source says this stroke requires a bit of friction to perform on most bodies.
Oh, less oil for this one.
Yes. Practical gold, too much oil will cause your fingers to slide over the skin instead of gripping and rolling it, making the technique impossible. You should perform the stroke slowly.
Why slowly?
This allows you to feel for restrictions and adhesions in the superficial fascia as you roll it. Can be done on most areas, but is most commonly performed on the back, calves, and forearms.
Okay. Petrissage clearly involves a different kind of interaction than effleurage. It's about actively lifting and manipulating the tissue, often drawing it away from deeper layers. Its uses, according to your source, range from assessing muscle layers and reducing spasms to affecting digestion and addressing subcutaneous adhesions.
Quite a range.
And it includes distinct techniques like kneading, with variations like scoop and shovel, bread kneading, wringing, fulling, muscle squeezing, emphasizing tissue release and coordinating with breath, and skin rolling, focused on superficial layers, requiring friction. Knowing the feel and precise application of each of these variations is crucial for effective work and demonstrating competence in your exam.
Precisely. Each technique under petrissage utilizes the core principle of lifting, stretching, or squeezing, but applies it in a specific way and to potentially different layers or areas, as detailed in the source. Mastering these variations allows you to address a wide range of tissue issues.
Okay, we've covered the smooth glide of effleurage and the lifting, squeezing manipulation of petrissage. Now let's explore friction. The description here seems markedly different again, focused on targeted compression and specific movement. What defines friction in your source material?
Friction is fundamentally described as a compression stroke.
Depression. Okay.
That's its core quality. It involves pressing into the tissue with sustained pressure.
And movement.
Yes. Your source explicitly states that it's a compressive stroke where superficial tissues are moved over and against deeper tissues.
Superficial moved over deeper. Got it.
This clearly defines the action. You're compressing down into the tissue and then moving the superficial layers, skin, fascia, superficial muscle, relative to the deeper underlying structures, deeper muscle, bone.
And the skin. Does it slide?
No, this is critical. A critical point distinguishing it from effleurage, and a key part of its description, is that the client's skin moves with the practitioner's hand.
Ah, skin moves with the hand, not sliding on the skin.
Exactly. This is not a stroke where your hand slides on the skin surface. Your hand and the client's skin surface must move together as a single unit over the underlying tissues. This is absolutely key to its effectiveness in breaking up adhesions.
Yeah. Oil use.
Because of this fundamental requirement, your source highlights a practical necessity. Oil use should be minimal to prevent gliding over the skin.
Right, makes perfect sense now.
If you use too much lubricant, your hand will slide on the skin instead of gripping it and moving it along with your hand, completely defeating the purpose of the stroke as described.
What tools can you use?
It can be applied with any part of the hand, forearm, or elbow.
Even the elbow, okay?
Yes. Means you can use fingertips for precise, localized work, the palm for broader areas, or the elbow for applying deeper pressure on specific points, depending on the target tissue and depth needed.
And the depth.
And it requires appropriate depth and pressure relative to tissue yield. You are working into the tissue to affect deeper structures or specific points of restriction. So you need to match your pressure and depth to what the tissue allows and what your therapeutic goal is, as outlined by its uses.
Minimal oil, skin moving with the hand, moving superficial over deeper tissues, requiring appropriate depth and compression. That sounds like it gets right to the point, targeting specific areas of restriction, unlike the broader strokes we've discussed.
Exactly. Very targeted.
What are the uses listed for this type of targeted work in your source? Why use friction?
The uses listed are quite focused on addressing specific tissue issues often associated with restriction, pain, or injury. It's used to increase local circulation.
Okay, locally.
Yes, the compression and movement can help stimulate blood flow in a specific targeted area, which can aid healing and tissue health.
What about pain?
It helps to reduce pain, likely by addressing the source of the pain, such as tight bands, trigger points, or adhesions, and potentially through neurological mechanisms like counter-irritation or stimulating mechanoreceptors. Your source simply states it reduces pain.
Okay. And tight muscles, spasms.
It can reduce spasm and hypertonicity in muscles. By applying focused pressure and movement to a tight or involuntarily contracted muscle, you can encourage it to relax. Hypertonicity, in this context derived from the source's use, refers to abnormally increased muscle tone or tightness.
Right. And the big one seems to be adhesions.
Yes, a major primary use explicitly stated is to release scar tissue and fibrous adhesions.
How does it do that?
Well, this directly addresses stuck tissues where layers of muscle, fascia, or skin have become bound together, limiting movement and causing pain. The mechanical action of moving superficial tissue over deeper layers, with the skin moving with your hand, is precisely what's needed to mechanically break apart these adhesions.
Makes sense. And organizing scar tissue.
Yes, relatedly, it's used to organize scar tissue formation. After an injury or surgery, new collagen fibers are laid down somewhat randomly. Friction, particularly linear friction, as we'll see, helps encourage these fibers to align properly along the lines of stress, promoting stronger, more functional tissue and preventing problematic adhesions from forming or maturing.
So it improves healing quality.
That's the idea presented, and it helps to increase tissue mobility and joint range of motion, likely as a direct result of releasing those adhesions and reducing hypertonicity.
Because the stuck bits are freed up.
Exactly. If tissues that cross a joint are stuck together, the range of motion at that joint will be limited. Releasing these restrictions helps restore the normal slide and glide between tissue layers, improving mobility.
So friction, according to your source, is all about getting into those specific points of restriction to release adhesions, reduce pain, improve mobility, and organize scar tissue. The description emphasizes compression and the skin moving with your hand. What are the techniques listed that embody this principle and achieve these uses?
Your source lists 4 main techniques under friction, each a specific application of the compression and movement principle. The first is circular.
Circular friction, like rubbing in circles.
Essentially, yes, but with that specific friction principle, it's described as rotary movement. The detailed explanation adds that it involves gentle compression of the tissue. After applying compression, you slowly move muscle and skin together in a circular motion.
Slowly, muscle and skin together. Got it.
Yes. The key here, linking back to the overall friction description, is that slow, deliberate circular motion where your hand and the skin move as one unit. This stroke can be used anywhere and is a great way to explore what is under the fingertips.
Explore.
Yes, the circular motion combined with compression allows you to feel for different tissue textures, restrictions, or taut bands beneath the surface.
Okay, circular. What's next?
Next is static, which is simply compression with no movement.
Static friction, just pressing.
Basically, the detailed section for static says it involves gentle compression of the tissue. Once that appropriate compression is attained, you hold that for 5-7 seconds, or if the tissue relaxes.
Hold for 5-7 seconds or until it relaxes.
Right. This technique is about sustained pressure on a specific point of restriction or tension. This stroke can be used anywhere on the body.
And what's it used for specifically?
Your source lists its uses as being specifically employed to relieve local ischemia and reduce spasm.
Ischemia, lack of blood flow.
Yes, ischemia in this context refers to restricted blood flow to a specific area. By compressing, you momentarily restrict blood flow, and upon release, there's a reactive hyperemia, increased blood flow. Holding the pressure can also encourage a taut muscle fiber or trigger point to release, thus reducing spasm.
Okay, static friction for ischemia and spasm. Now, the really specific one seems to be transverse.
Yes, transverse is a very important and specific technique, especially for addressing adhesions. It involves movement perpendicular to tissue fiber alignment.
Perpendicular, across the grain.
Exactly. The detailed explanation for transverse elaborates significantly. Gentle compression of the tissue. Once compression is achieved and you engage the tissue, you slowly move the tissue perpendicular to the underlying muscle fibers.
Slowly across the fibers.
This is the defining action. Your source clarifies that the skin will be moving with and perpendicular to the muscle fibers and surrounding aponeurosis.
Aponeurosis, that's connective tissue.
Yes, a sheet of connective tissue. This explicitly reinforces that the skin moves with hand principle is essential for transverse friction to be effective. The source is saying the skin moves with the muscle fibers and surrounding connective tissue sheath.
And the goal.
Performing this technique will break up the adhesions. This directly ties the specific movement and mechanism to a key use. This stroke can be performed anywhere on the body, but is generally appropriate in the back and the limbs.
And there were specific requirements for this one. Sounds like important exam details.
Yes, your source is particularly detailed about the requirements for transverse friction strokes to be effective, laying out specific criteria that must be met. These are crucial points for your practical exam demonstrating this technique.
Okay, what are they?
They must be preceded by a thorough warming of involved tissues.
Warm up first. Makes sense.
They must be applied to the exact site of the lesion at right angles to the fibers. Precision is key.
Exact site, right angles. Got it.
They must be applied deeply enough to effectively penetrate the site. Need to reach the problem.
Deep enough, okay.
They must be long enough in sweep to separate the adhered fibers. The stroke needs enough length.
Long and a sweep.
They must be applied with the fingers and skin moving together as one unit. That core friction principle again.
Skin moves with fingers. Check.
They must be repeated frequently enough to have a progressive impact, not a one-off fix.
Repeated frequently, okay.
And they must be performed with the muscle or tendon in a relaxed position, except for a pin and stretch.
Relaxed muscle, usually.
Right, makes the tissue more accessible and allows you to work with the fibers effectively, though your source notes a variation where the muscle is put on stretch.
Wow, that's a lot of rules for transverse friction. Very specific.
Extremely specific, shows the care needed.
Oh, okay. Was there one more type of friction?
Finally, there is linear friction. This is described as movement parallel to tissue fiber alignment.
Linear, so along the grain. The opposite of transverse.
Exactly. The detailed section on linear explains gentle compression of the tissue. Once appropriate compression is achieved and you're engaged with the tissue, you slowly move your fingers and the tissue in line with the underlying muscle fibers.
Slowly, in line with fibers.
Right. Your source states that this technique will realign the muscle fibers and encourage them to heal properly. It's presented as a stroke that helps restore the natural, orderly arrangement of the tissue fibers after they've been disrupted or worked on.
So like a tidying up stroke.
Kind of. This can be applied anywhere on the body. It also notes a specific recommendation. It can also be used at any time, but it is crucial that you follow up the other friction techniques with this one.
Ah, use it after the others.
Yes, this suggests linear friction is often used as a finishing stroke after applying circular, static, or transverse techniques, helping to smooth out and organize the tissue you've just manipulated.
That's a lot of specific instruction, particularly for transverse friction. It really highlights how precise this stroke needs to be. emphasizing the anatomical knowledge needed to apply it correctly.
Absolutely.
Your source details exactly how the compressed movement, minimal oil, and skin moving with your hand principle is applied, especially for transverse moving perpendicular to fibers to break adhesions and linear moving parallel to realign them.
Mhm.
So friction is about compressed movement where the skin moves with you, used for pain, spasm, adhesions, scar tissue organization, and mobility, with techniques being circular, static, transverse with those strict requirements, and linear, often used for finishing.
That sums it up based on the source. The effectiveness of friction, particularly transverse friction for specific lesions, is highly dependent on understanding and mastering those specific parameters and mechanics detailed in your source. For your exam, articulating those points is just as important as performing the stroke correctly.
Right. Okay, let's shift gears again to something that introduces a different element altogether. Rhythm and tremor. This is oscillation, also known as vibration. How does your source describe this stroke? It sounds like a totally different approach to interacting with the tissue compared to gliding, lifting, or specific compressed movement.
It is quite different. Oscillation is described as a rhythmic back and forth movement of a tissue or body part.
Rhythmic back and forth.
The key elements here are the consistent rhythm and the back and forth nature of the motion. Your source specifically notes that it imparts a penetrating tremor into the body.
A tremor, like shaking.
Yes, a vibration or tremor that travels from your hands into the client's tissues and potentially deeper. It can involve movement at a joint.
Moving the joint rhythmically.
Yes, the rhythmic action might be applied in a way that mobilizes or introduces movement into an articulation, or rotation about the longitudinal axis of the body part,
Rotating back and forth.
essentially rotating them back and forth along their length. It's applied with the palm or fingertips held flat against the body.
Flat contact.
Yes, you need a stable, flat contact area, whether broad with the palm or more focused with fingertips, to effectively transmit the vibration or rhythmic impulse into the tissues.
Rhythmic movement and tremor that penetrates deeper, potentially involving joint movement or rotation. That certainly sounds unique compared to the others, which were more about contact and movement along or with tissue layers.
Very unique feel.
What are the listed uses for oscillation, according to your source? How does this rhythmic penetrating action benefit the client?
The uses provided in your source reflect the stroke's ability to penetrate and influence deeper structures or systems. It's used to penetrate to deeper, less accessible structures.
How does the tremor help reach deeper?
Well, the tremor effect is thought to allow the therapeutic action to reach layers that might be harder to access with direct manual pressure alone, essentially sending waves through the tissue.
Okay, circulation again.
It helps to increase local circulatory potential. Fluid dynamics in the area where it's applied.
Pain reduction.
It's listed to decrease pain. The rapid stimulation from the tremor may have a neurological effect, potentially interfering with the transmission of pain signals to the brain or encouraging the release of pain-modulating substances.
Okay, and the source mentioned organs.
Yes, your source explicitly lists increased visceral organ function.
That's surprising again. How?
It's one of those surprising uses that directly links back to the idea of the tremor penetrating deeply, potentially influencing the activity or motility of internal organs, particularly when applied over the abdomen or chest. This is a fascinating application mentioned in your source.
And joints.
And it helps to increase joint function. The movement at a joint or the tremor applied around it may help improve mobility, reduce stiffness, or stimulate proprioceptors, those sensory receptors that help us know the position of our body.
Increasing visceral organ function and joint function from what's described as a rhythmic tremor. That's quite interesting and shows how this stroke can have systemic or deeper effects according to your source.
It does suggest broader effects.
What are the specific techniques described for applying oscillation? How do you create that tremor or rhythmic movement effectively for these uses?
Your source lists several distinct techniques under the oscillation umbrella, each applying the rhythmic movement or tremor principle in a different way. First, there's vibration, trembling.
Vibration or trembling, okay.
This involves a tremor directed into the body perpendicular to the skin surface. The detailed section explains. This technique is done by placing one hand on top of the other and sending small tremors into the tissue.
Hand over hand for stability.
Seems so, helps generate and transmit a consistent, controlled tremor more effectively. It can be done using either your fingertips or the palm of your hand, offering versatility depending on the area and focus.
Do you stay in one spot?
It notes this can also either be done statically or by moving your hands along the surface. So you can hold the vibration in one spot to penetrate deeply or move it across the tissue.
How much pressure?
There is not much pressure needed with this technique as it's all about the tremors.
Okay, focus on the tremor quality. That's key for the exam.
Exactly. The focus isn't on deep compression, but on generating and transmitting the quality of the vibration into the tissue.
Okay, vibration trembling. What else?
Then there's shaking. This technique moves bone and surrounding soft tissue together as a unit.
Shaking the whole limb.
Pretty much. The detailed explanation for shaking says, this technique is performed on the arms and legs. It's specifically applied to limbs. While supporting the ankle wrist, gently apply a small amount of traction on the limb and rhythmically bounce the limb on the table.
Traction and bouncing.
Yes, you are essentially creating a gentle, rhythmic oscillation or shaking of the entire limb with traction applied to the joint. Having low amounts of lubrication applied will help with the grip around the joints.
Need a good grip. Less oil again.
Yes. A practical tip, you need a secure hold on the limb to control the shaking movement effectively. And too much oil would make your hands slip.
Okay, shaking for limbs. Next.
Jostling is described as rotating soft tissue around a bone shaft.
Jostling. Sounds like jostling.
It does. The detailed section provides more context. Gently wrap your hands around the upper portion of a limb. You're grasping the bulk of the muscle tissue. Slightly lift up the limb and move the tissue as if rotating around the bone.
So grabbing the muscle and wiggling it around the bone.
Basically, yeah. You're grabbing the muscle mass and rhythmically moving or jostling it around the central bone of the limb. This technique works best with the leg, but it can be done on the arm as well. Suggests the larger muscle mass of the thigh or calf lends itself particularly well.
Jostling for limbs, especially legs. One more.
Finally, there's rocking. This technique moves the whole body part, seeking its natural rhythm.
Rocking the whole body.
Yes. The detailed explanation instructs, ensure the client is completely draped, important for modesty. Starting at pretty much any spot on the side of a body, gently push the body away from you. Initiate a gentle push.
Then?
As the body comes back, gently push the body again as you move along the side. You are creating a gentle, rhythmic sway of the body. Continuing this movement as you move along the client's side, you should create a rhythm as you move.
Find their natural rhythm.
Emphasizes the smooth, continuous, rhythmic nature of the stroke, allowing the client to relax into the motion. This technique can be performed with either the palms or the back of the hands. It can also be done with either both hands on one side or one hand on each side, allowing for variations.
So based on your source, oscillation is about rhythmic movement and creating a penetrating tremor, used for accessing deeper structures, increasing circulation, decreasing pain, potentially increasing visceral organ function, and increasing joint function.
That's the summary.
The techniques listed include specific types of vibration, trembling, transmitted perpendicularly, shaking limbs as a unit, often with traction, jostling tissue around bone, primarily on limbs, and rocking the whole body to find its rhythm. It's the element of sustained rhythm and vibration that distinctly sets this group apart from the others.
It truly is. It's a more energetic, yet potentially very soothing, depending on the variation and speed, interaction with the body. Understanding how to generate and transmit that tremor or rhythm effectively is key to these techniques, as described in your source.
Right. Okay, our fifth and final stroke to dive into today, according to your source material, is tapotment, also known as percussion. This one sounds like it definitely involves impact. How is this described?
Yes, impact is key. Tapotment is described fundamentally as rhythmic striking or percussion of tissue.
Rhythmic striking.
The core action is hitting, tapping, or chopping the body surface repeatedly in a rhythmic manner. It's noted that it delivers a penetrating impact. While rhythmic, there's an element of impact with each contact that goes beyond mere touch or compression.
How is it applied? What part of the hand?
Your source lists that it's usually applied with fingertips on the border of the hand, open or cup hand, or soft fist.
Wow, lots of options there.
Yes, a wide variety of hand shapes are used for tapotment, each producing a different quality, intensity, and sound of strike.
And how's it performed? Stiff wrists.
No, importantly, it's performed with loose wrists and hands.
Loose wrists. Okay, that's crucial.
Absolutely crucial for generating the rhythmic rebounding action without jarring the client or fatiguing yourself. The primary movement often originates from the elbows or shoulders, but the wrist and hand remain relaxed to allow them to bounce off the body surface smoothly and rhythmically, absorbing some of the impact.
Rhythmic striking that delivers impact using different hand shapes with loose wrists that gives a clear picture of the fundamental action and how to execute it without hurting yourself or the client. What are the specific uses listed for tapotement in your source material? Why would we use this stroke?
The uses listed show that tapotement can have quite varied effects depending on how it's applied, speed, and intensity. It can stimulate and sedate.
Stimulate and desedate. How can it do both?
Shows it has a dual potential. Fast, light percussion, like tapping, can be stimulating, invigorating blood flow and nerve endings. Slower, heavier percussion, like beating or pounding, can sometimes be sedating or pain blocking.
Okay, so it can block pain.
It's listed to block pain. The rapid, repetitive stimulation from the striking action might overwhelm pain signals traveling to the brain or trigger the release of endorphins, providing analgesic effects.
And hypertonicity. Can it reduce tightness?
It can reduce hypertonicity potentially by fatiguing the muscle fibers being struck or stimulating relaxation reflexes through the rapid impact.
Okay. What about breathing? Congestion?
Yes, a very common and well-known use, especially with certain techniques like cupping, is to reduce respiratory congestion.
Like pounding on the back when someone's coughing.
Sort of, but more controlled. Applied over the chest or back, techniques like cupping help to loosen mucus in the lungs and bronchial tubes through vibration and impact, making coughing more effective for clearing the airways.
Right. Circulation.
And like many strokes that stimulate tissue engagement, it helps to increase local circulation. The repeated impact brings blood flow to the surface and underlying tissues in the area being struck.
Stimulating, sedating, pain blocking, reducing congestion. It seems to have quite varied and powerful effects depending on the technique and application, according to your source.
Very versatile in its effects.
What are the specific techniques that create these impacts and achieve these uses?
Yeah.
There seem to be quite a few listed under tapotement, corresponding to those different hand shapes you mentioned. This is prime exam material.
Yes. Tapotement, as listed in your source, has the most variations, each named after the specific hand shape and movement used. First, drumming is described as a light fingertip strike without wrist movement.
Drumming. Light fingertips and no wrist movement.
Correct. The detailed section on drumming adds it's performed primarily with the fingertips and keeping the wrist rigid. This is an exception to the general rule of loose wrists mentioned in the main description of tapotement. Here, the movement should originate at the elbows.
Movement from the elbows.
It's a rapid, light strike using just the fingers. It can be performed on most parts of the body, but commonly done on the back legs and arms.
Okay, drumming, then tapping.
Tapping is a different fingertip technique. It's a fingertip strike with wrist movement.
This one does use the wrist.
Yes. The detailed explanation for tapping clarifies. It's performed by lightly striking the body rhythmically with the fingertips and keeping the elbows rigid. Here, the movement comes from the wrist.
Elbows rigid, movement from the wrist, opposite of drumming.
Exactly. This is the more common variation where the loose, rapid flexion and extension of the wrist generates the tapping rhythm. This technique can be performed on most parts of the body, but commonly done on the back, legs, and arms.
Okay, drumming versus tapping is clear now. What's pincement?
Pincement is described as a fingertip and thumb strike, flick on rebound.
Strike and flick.
Yes. The detailed section on pincement adds, this technique is a tissue lifting movement. This is unique among tapotement techniques, incorporating an element of lifting despite being listed under percussion.
Lifting? How?
You lightly strike the body with your fingers and thumb, and as you pull away, close your thumb to your fingertips in a pinching motion.
Like a little pinch on the way up.
Exactly. This action aims to lightly grasp and lift the skin and superficial tissue with each rhythmic strike and rebound. You should alternate hands and create a rhythm as you strike the body, suggesting it's typically performed with alternating hands.
Pincement. Interesting. Hacking. That's the karate chop one, right?
Kind of. Hacking is described as a strike with fingertips or palm of ulnar aspect of hand.
Ulnar aspect. Pinky edge.
Right. The detailed explanation provides more depth. Using the ulnar edge of the hand, rhythmically strike the body. This is the characteristic chopping motion. For light hacking, use more of the fingers on the hands. For heavy hacking, Use more of the palm side of the hand.
Okay, so you can vary the intensity easily.
Yes, explicitly tells you how to vary the intensity by changing the contact surface of the ulnar edge. You should start slowly and gradually increase to the desired speed. Hacking can be done on most areas of the body. Back, glutes, legs, and arms are the usual locations.
Hacking, got it. Cupping, you mentioned this for congestion.
Yes, cupping is a very specific technique, described as a strike with cupped hand. The detailed section specifies. It's performed by forming a cup shape with your hands and slowly, rhythmically striking the body.
Why the cup shape?
This cup shape traps air between the hand and the skin upon impact. If done correctly, there will be a light popping sound made with the hands.
Ah, the popping sound, that's the sign.
Yes, this distinctive sound indicates proper technique and effective vibration being transmitted into the chest wall or abdomen, making it particularly useful for reducing respiratory congestion, as listed in the uses. This technique can be performed on most areas of the body, but shines on the back and abdomen.
Cupping for congestion makes that sound. Okay. Slapping.
Slapping is listed as a strike with flat hand. The detailed section describes it simply as slapping, performed by rhythmically striking the body with an open, flat hand.
Flat hand.
Using the full surface of the palm, you should start by slowly and lightly striking the body and gradually increasing the speed and firmness. It indicates how to introduce and progress it safely. This can be performed on most areas of the body, but is most commonly performed on the back and feet.
Back and feet for slapping. Interesting. Beating.
Beating is listed as a strike with soft fist pronated.
Soft fist, palm down.
Exactly. The detailed section explains. Performed by creating a soft open fist and rhythmically striking the body with the palm fingers of the hand. This isn't a closed hard fist, but a softer impact tool using the padded part of the hand when the fist is loosely formed and pronated.
And the movement. Wrists.
Movement should start at the elbow and wrists somewhat rigid. Similar to drumming, the primary movement comes from the elbow rather than a loose wrist flick.
Elbow movement again. Where is beating used?
This technique is generally used on areas of the body with sufficient muscle tissue. It requires a decent amount of padding on the client to be comfortable and effective, so areas with significant muscle mass are preferred.
Okay, beating for muscular areas. Last one is pounding.
Yes, heavy pounding is listed as a strike with ulnar aspect of soft fist.
Soft fist again, but the pinky edge this time. Like hacking, but with a fist.
Sort of, yeah. The detailed section clarifies. Performed by creating a soft open fist and rhythmically striking the body with the ulnar aspect of the hand. Instead of the palm side like beating, you're using the pinky edge of the loosely formed fist.
What's movement for?
Movement should start at the elbow and wrist somewhat rigid. Again, the movement is primarily from the elbow with a relatively firm wrist.
And use where?
This technique is generally used on areas of the body with sufficient muscle tissue. Similar to beating, it's best suited for areas with substantial muscle bulk.
So, according to your source, Topotment is rhythmic striking, delivering impact, using various hand shapes. Fingertips, ulnar border, open cupped hand, soft fist, predominantly with loose wrists. Though exceptions like drumming, beating, and pounding are noted as using rigid wrists with elbow movement. That's a key detail for the practical.
In theory.
Its uses include stimulation, sedation, pain blocking, hypertonicity reduction, respiratory congestion relief, especially cupping, and circulation increase. The techniques are drumming, rigid wrist, elbow movement, tapping, loose wrist, pincement with a unique lifting flick, hacking, ulnar edge, variable intensity, cupping, creating a popping sound, good for congestion, slapping, flat hand, variable intensity, beating, soft fist, palm side, elbow movement, and pounding, soft fist, ulnar side, elbow movement, each creating a different kind of impact and vibration tailored to specific uses in body areas. Knowing these distinctions and the mechanics is vital for demonstrating proficiency.
Correct. The wide variety in hand shape and described movement allows Topotment to range from very light, stimulating taps to heavier, muscle-compressing beats, each with its own specific feel, sound, like cupping, and application according to the uses listed in your source.
We've covered a lot today, taking a really close, detailed look at effleurage, petrissage, friction, oscillation, and Topotment, focusing only on their descriptions, uses, and techniques as detailed in your source material. We've broken down the what, why, and how for each foundational stroke and its variations, staying strictly within the provided text to give you the precise language and understanding for your practical exam.
That's exactly right. Understanding these foundational elements, the exact definition as written, the intended purpose as listed, And the specific way each technique is performed, as described in the detailed sections, is absolutely critical for that practical exam.
And for actually doing good work.
And, more importantly, it's critical for effective, intentional application in your practice. We've aimed to highlight those precise nuggets of information, connecting the mechanics to the uses, drawn solely from your source.
Right. You need to be able to articulate the effleurage is smooth and gliding with continuous contact for introduction and transition.
Yes.
Petrissage lifts and squeezes tissues away from underlying structures for assessing muscle layers and releasing subcutaneous adhesions. Friction involves compressed movement where the skin moves with your hand for releasing deeper adhesions, pain, and organizing scar tissue.
Crucial distinction there.
Oscillation adds rhythmic movement and tremor for accessing deeper effects and potentially increasing visceral function.
The rhythmic element.
And tapotement is rhythmic striking with varying hand shapes and loose wrists for varied impacts like reducing congestion or stimulating circulation.
Exactly.
Knowing how each specific technique, like skin rolling, requiring friction, transverse friction with all its strict requirements, shaking on limbs with traction, or cupping, creating that pop sound, is performed, describing the exact hand position, movement origin, wrist versus elbow, and goal based on the source.
All those details matter.
And why you would use it based on the listed uses from the source is what will demonstrate your competence in your practical exam.
As you practice and prepare, think about how the exact way a stroke is described in your source, whether it's continuous contact, tissue drawing away, skin moving with the hand, imparting a tremor, or rhythmic striking with loose wrists, mostly, directly enables its listed uses. How does the mechanism described in the source facilitate the therapeutic effect it claims?
Okay, so here's something to mull over based on everything we've discussed today, straight from the material itself. Considering the very specific and numerous requirements for effectiveness listed only for transverse friction, like being applied at right angles to the fibers, deeply enough, with the skin moving as one unit, at the exact site of the lesion, and only after warming.
Oh, there's qualifiers.
What does the presence of all those specific details in your source imply about the level of anatomical understanding and palpatory skill needed to perform that single technique effectively, compared to, say, performing a broad effleurage sweep, which your source describes more simply as broader lengthy strokes, often ovals and figure eights, performed at a slow, consistent speed? Think about the demands each places on the practitioner, based only on the definitions and instructions provided in the source you're studying. What does that tell you?